The views and opinions expressed on this program are those of the participants and do not reflect the views of BronxNet or the program underwriters.
BronxNet. Your voice, your views, your vision.
Hospital Center's Vice President of Planning, Marketing, and Public Relations, your co-host for tonight's HealthBeat television program. We welcome you, our many viewers, and also encourage you to continue participating in the program by calling 718-960-7241 with any questions you may have. That's 718-960-7241. As always, we promise to do our very best to keep you medically informed and healthy by discussing the topics that are of interest to you. Please tune in every Monday evening from 6:30 to 7 p.m. on Channel 67. And you can also find out more information about Bronx, Lebanon, and its many community services online at our website, bronxcare.org. Tonight, my co-host, Dr. Milton Gums, Bronx, Lebanon's Vice President and Medical Director, and I will be discussing women's health issues and the services that are available to the Bronx community.
Yes, Errol. Women's health is always of interest to our viewers. And joining us this evening is Dr. Robert Hecht, Director of Women's Health and Gynecologic Ambulatory Surgery at Bronx Lebanon Hospital Center. Dr. Hecht is a widely acknowledged expert in the field, and welcome, Dr. Hecht.
Thank you. It's nice to be here.
Now, Dr. Hecht, before we hear from you, though, let me encourage you, our viewers, to call in with any questions or comments you may have. The number to call is 718-960-7241. That's 718-960-7241. And please call us. Now, let me begin the program, Dr. Hecht, by asking you to share with our viewers, describe for them the services that are available at the Women's Health Center.
Well, we offer a vast array of services, everything from prenatal care to abortion services to STD screening to menopausal management, vaccines, pretty much anything that a woman might need for health care during her life cycle.
Is there an age to the services that are offered? How does that work out?
We take all ages. We're very inclusive. You just can't be a guy. We try to take care of everybody, but we take care of women of all ages and deal with problems in teenagers and menopausal, postmenopausal population, all across the spectrum of women's health.
What makes these services unique?
Well, I think what we've done is really provided a one-stop shopping area for women. I think that the hospital's done a great job of incorporating all the services that a woman might need under one roof and really trying to make it easy for the patients to come to the Women's Health Center and get pretty much anything.
Yeah. So if a 14-year-old comes, she can come to your floor. If a 90-year-old comes to your floor.
Absolutely.
Right? And everything can be accommodated there.
Yes, and whatever they would need. If the 14-year-old, for example, needs an HPV vaccine, we have that. If the 90-year-old needs a urogynecology referral, we have a subspecialty clinic for that as well.
Yeah. But let me ask you a difficult question. If someone sees you tonight on TV and they want an appointment with you tomorrow, what's your availability? What's the standard waiting time to get seen? I know it's a difficult question, but answer me.
Oh, certainly, I'd be happy to. We've really made an effort to keep our availability as open as possible, and most appointments can be made for people within a few weeks. We also have walk-in hours every day that the clinic is open, so if somebody has an urgent problem, they can get in that day to be seen. If somebody wants to see me, actually, because I'm relatively new, I have a very short backlog for appointments, so they're in luck. I'm very available.
Okay. Now, expanding on Dr. Gums' question, how would you define your own role now at Bronx Lebanon?
Well, my title is Director of the Women's Health Center and Director of Gynecologic Ambulatory Surgery. So my job is basically to help run the women's health services and also the ambulatory surgery center that we have within the hospital.
So you're saying the waiting time is not very long, not necessarily for you, but in general. If I come there today, do I get seen in a respectable time, or do I have to hang around? These are questions that may not be asked by the people who are calling in tonight, but they are of concern to them.
Yes, let me take that in two parts. The wait for an appointment, as I said, we're doing our best to keep as short as possible. The wait time on a daily basis, we're also really working hard to keep as short as possible. If you come in as a walk-in, clearly, and there are a lot of people who walked in, you may wait a little while, but for the most part, we're doing
And you
everything.
try to stick to your times.
We're doing our
Schedules,
best, and we're constantly trying to improve that.
Okay. Let us now focus on the women's health team itself, including the various types of providers. You sort of told us that you have everybody, so just tell us exactly what you have there. You know, just break it down for the viewing audience.
Sure. Well, we have all types of providers. We have physicians, we have resident physicians, we have nurse midwives, and we have physician assistants. We also have subspecialists, so we have subspecialty clinics for urogynecology, for gynecologic oncology, and for infertility. So the whole range of providers are available within the clinic.
Yeah. And it's not difficult to get an appointment. I keep bringing it up because I know that it's of concern.
Yes, as I said, for most appointments, I think we're accommodating people within a few weeks. And for urgent things, as I said, we have a mechanism for accommodating people much more quickly if need be.
Okay.
Now, in terms of women making these appointments, how often should they come in to see an OBGYN physician?
Well, it depends on what sort of issues they may have.
Say for a routine situation.
Routine exam is definitely recommended yearly. There's a lot of confusion about that. I'm glad you asked that question because now that there are recommendations regarding pap smear screening where some women may not need a pap smear every year, it is still recommended that those women have a yearly physical each year. And there are other health issues that we address at that physical exam, and whether it's breast health or screening for other gynecologic cancers, it's an excellent question. And as I said, I think there's a lot of confusion. I still think it's very important for most women to have an annual gynecologic
So it's
exam.
a very thorough exam, in other words, when they come in.
Oh, absolutely. A full gynecologic exam is really a head-to-toe exam with a focus on the pelvic organs, but we typically will listen to the heart and lungs and do a full breast exam, abdominal exam, full pelvic exam.
Right.
Okay, well, I'm a surgeon, so I'm going to ask you some questions about surgery. What types of surgery you perform and your team performs at the center? And then those that you don't perform at the center, let me know where they're performed. And then we'll ask you some other questions.
Okay. Well, all the major surgery we're performing in the hospital. So if we see a patient in the Women's Health Center who needs major surgery, that will get booked in the hospital and the patient will be taken care of there. We are currently starting a program to do outpatient surgery in an office setting. Right now we're doing that within the ambulatory surgery center in the hospital, but we'll soon have a program where we can do that at some of our off-site clinics. So for example, if a woman comes in and is having abnormal bleeding or an issue like that, sometimes we can actually perform minor surgery in an office setting, and it's much more convenient and easier for the patient to have it done in that
So
setting.
what are you going to do on your unit? What sort of surgery are you going to do on your specialty floor?
Well, at this point, I think the plan...
Not necessarily, no. Down the line, what are you planning to do in that area?
Well, down the line, the same things that we're bringing to the outpatient clinics, we hope to bring to our clinic in the main part of the hospital. And there's no reason that we couldn't eventually expand that program so that we're doing hysteroscopy, for example, which is an evaluation for abnormal bleeding, or LEAP, which is a treatment for abnormal cervical cells, right there in the clinic. And that's certainly something that may be in our future.
Okay.
Now, what types of surgery do you yourself perform?
Any sort of gynecologic surgery, hysterectomy, do a lot of surgery as alternatives to hysterectomies, whether it's hysteroscopic surgery, which means putting a fiber optic camera into the uterus, and sometimes we can address bleeding problems and that through that route rather than having to take the uterus out. Also endometrial ablation, which is another procedure which may reduce the need for hysterectomy, which is aimed to reduce abnormal bleeding. We also do all sorts of laparoscopic surgery as well.
Hysterectomy is not as common as it used to be, right?
That's correct.
You want to talk a little bit about that? Why the variations?
Well, I think it's primarily because we've developed so many other great alternative treatments. And a generation ago, women who had problems with fibroids or abnormal bleeding didn't have the same sorts of alternatives that women have today. And I mentioned endometrial ablation. That's become a great alternative to hysterectomy and has prevented a lot of women who have abnormal bleeding from needing to have the uterus removed.
You have a lady who's 40 years old and married, no children, but has fibroids. What do you offer this lady? Just give me an idea.
Well, there are a whole variety of treatments. If she's having bleeding issues, sometimes this can be managed medically. So,
Just
for example,
fibroids,
things
just
like
fibroids, large fibroids that she's concerned about, hasn't been able to be pregnant for a while, but wants to be pregnant.
if she's interested in getting pregnant, then your choice is really, if the fibroids need to be removed, you have a choice of removing them either laparoscopically or through open surgery. And then there are also new radiologic procedures that are being evaluated for ultrasound ablation of fibroids. There's also uterine artery embolization, although there's not that much data on the safety of that for women who want to get pregnant subsequently.
Yeah.
So the real...
But there are options for the lady who doesn't want to lose her uterus right away.
Oh, absolutely. And as I said, more than ever before.
Oh, yeah. Okay.
Now let's go back to some of the new services that you said are offered. Can you describe them for our viewers?
Sure. There are two actually very exciting things that we're working on for the clinic. One of them is the what's called first trimester screen, which is a newer test for Down syndrome. Traditionally, testing for Down syndrome involved a blood test that was done in the second trimester. And the newer test, this first trimester screen, has the advantage of not only being done earlier, so the patient gets the information earlier, but it's also more accurate. There are fewer false positives and false negatives, so it's just a better test. So that we're implementing fairly soon in the clinic. And then there's also a female sterilization procedure that we're also working on making available in the office setting as well.
Just 1 second. We have a call. Vivian, you're on the line. You have a question for us?
Yes, I do. I have actually two, and I'd like to know at what age do you think you should switch from a pediatrician to an obstetrician, or? And my second question is in regard to those Gardasil shots for girls and boys. Do you think they are good?
You heard the question?
Yes, I did.
Okay,
I heard them
okay.
both. Let me take the Gardasil question first, if you don't mind. I'm a big fan of Gardasil. I think it's a great thing. If you have a daughter and you give her Gardasil before she's sexually active, you reduce her risk of cervical cancer by 70%. You reduce her risk of genital warts by over 90%. Huge, huge benefit. So, and it has the same safety profile as any other vaccine. So I think it's a great thing.
At what age?
And that can actually be done starting at age 9, although there's not necessarily an urgency to do it that early. My recommendation is to get it before the child is sexually active, so usually that leaves you a window of time to play with there. In terms of when a child should switch from pediatrician to a gynecologist, I think a lot of that really depends on what sort of advice and counseling you're getting from your pediatrician. The most important thing that we do with young women is to talk to them about sexual activity, about STDs, and to give them that sort of information, assuming they're not having any other sort of problems. So if your pediatrician is doing a good job with that, then that's great. And I don't think there's an urgency to get them into a gynecologist. I think for most adolescents, it's awkward, it's stressful, they're at a difficult age, body image issues and all that.
Okay, thank you, Vivian. Believe it or not, I think we have a guy. Dennis, do you have a question for us?
Yes, I do, Dr. Gums. I'd like to know whether or not you will be conducting the one-stop wellness or preventive exams for women at the Women's Health Center.
The one-stop shop. One-stop shop. You can get anything, right?
Yeah, I'm not sure if you're referring to something specific. I mean, we're doing our best to make it a one-stop experience. If somebody, for example, comes in and is seen and they get a prescription for birth control pills, that can be filled at the hospital pharmacy. They have it in their hands before they walk out the door. If somebody wants Depo-Provera, we stock that in the clinic. They get the shot in the clinic. If somebody wants an IUD, they're stocked in the clinic. That's administered in the clinic. If that's what you're referring to, we're really doing our best to try to incorporate as many things as we can into the
Well, I think
clinic
that's what
setting.
he meant. I think that's what he meant. That's what you meant, right, Dennis?
Well, not quite. I think what I meant was whether or not I'm new to the neighborhood and I want an exam. I don't have a gynecologist, and I just want an annual physical. Can you make an appointment and get one done as such?
Oh,
Yes,
absolutely.
definitely. Yes.
All right.
You can, and you can bring your wife, and we'll send you downstairs.
On that note, let's now pause for a short break, and when we return, we will continue our discussion, as well as also take calls from you, our viewers. Once again, the number to call is 718-960-7241. That's 718-960-7241, and please call us.
Bronx Lebanon surgeons are experts in the field, bringing a diversity of skills and cutting-edge operative procedures to their patients.
But what is most important about our Bronx Lebanon surgeons is that they are responding to many difficult challenges and saving lives.
Nurses at Bronx Lebanon are also an integral part of the OR team.
We work with the surgeons in the operating and recovery rooms and are at the patient's bedside providing the necessary support and compassionate care.
In the ICU, our critical care specialists evaluate, treat, and monitor patients until they're strong enough to be transferred to a med-surg floor.
Sometimes surgical measures are necessary to breathe life back into patients, and ear, nose, and throat surgeons are called into action. Bronx Lebanon's oral and maxillofacial specialists are widely acknowledged for their expertise in all types of dental surgery.
From tooth extractions under intravenous sedation, the emergency treatment of facial injuries, to innovative implant procedures, we are clearly placing smiles for miles in the Bronx.
Bronx Lebanon is also leading the way in cardiology, dermatology, internal medicine, infectious diseases, neonatology, nephrology, neurology, pediatrics, family medicine, pathology, psychiatry, and radiology. And its Bronx Care Network, including a soon-to-be-completed ambulatory care facility, is fulfilling the hospital's essential role as doctor to the community.
Come to you live on BronxNet every Monday evening from 6:30 to 7 p.m. Please call us at 718-960-7241 with any questions you may have, and we will certainly do our best to answer them. That's 718-960-7241. Now let's continue our discussion. Doctor, we often ask our panelists to share their respective backgrounds with our viewers. Can you share your background and even tell us why you chose obstetrics gynecology as your specialty?
I'd be happy to. I went to medical school at Columbia University. I did my residency at the New York Hospital Cornell University Medical Center. After training, I went into private practice in Rockland and Orange counties in New York, and I've been there since training until I started here at Bronx Lebanon. I was also the director of OBGYN at Good Samaritan Hospital in Rockland County for 5 years as well. Women's health care is a great field. We get to take care of women across the whole, all through their lives. We get to do surgery. We get to provide primary care. We get to do low-tech things, high-tech things. It's really an incredibly broad field. And we get the joy of surgery and also the rewarding relationships of taking care of people over the long term.
Well, we sort of repeated, I'm going to repeat this question, but what are some of the common conditions that you and your staff treat? Break it down for us, please.
Sure. Well, we get women who come in often with signs and symptoms of vaginitis, especially during the walk-in hours. And most of those women don't want to wait weeks for an appointment, which is part of the reason we have all those walk-in slots. Women who come in with pain or abnormal bleeding. We get women who need birth control, women who come in for prenatal care, women with menopausal complaints, osteoporosis, vaginal dryness, all sorts of issues like that.
And women were just moving into the neighborhood.
Yes, yes, women who
like
just need a checkup, like Dennis.
Okay, good.
Now, can you describe some of the screening tests that are performed, and also your recommendations concerning them, when they should, the frequency, when they should be done, etc.?
Sure. For women in menopause, we're currently recommending that they have yearly mammography.
Right.
I would recommend that they have yearly mammography, I should say. Bone density study every 2 years. Colonoscopy every 10 years.
Right.
And these things all have to be put in the context, of course, of the patient's family history and her own risk factors, because each person may have different things that may influence that. Pap smear screening I mentioned previously, now for women who's had several normal pap smears, that can be done less frequently.
Let me ask you a question that has evolved over the years, even on this show. What's the role of replacement hormonal therapy in the menopausal period? What do you tell us?
Oh gosh, that's a show.
It has evolved,
yes,
right? Yeah,
a show in and of itself.
Okay.
The pendulum. You've been in women's health for a long time.
Yeah.
You know the pendulum has swung back and forth quite a bit. The concern right now is that there are several significant serious health risks associated with hormone replacement therapy. And while there are some benefits, it's always a question of balance. And especially for some of these benefits, they can be obtained through other medications. To give you an example, hormone replacement therapy is certainly a treatment for osteoporosis, but there are also other treatments that we have now that don't increase the risk of breast cancer or stroke. So the role for hormone replacement therapy in that area certainly has been diminished. But for women who have hot flashes or who have issues with vaginal dryness, there's very little else to offer them. So there still are women who are going to need it or want it, but I think the role for it is definitely less than it used to be.
What about the role for diet and vitamins in women's health? Who do you advise about a specific diet, and who gets vitamins? Do you believe in vitamins?
Well, I think diet is critically important. As you know, in this country we have about 2/3 of our population that's obese. It's extremely important for us to be focused on that when we're seeing our patients and discussing all the things that go into a healthy diet.
Specifically for OBGYN, what is obesity a problem with?
Well, as you know, it increases the risk for many general health issues, things like diabetes and high blood pressure.
Specifically for your area.
Well, because we're sort of primary care, those play into it a little bit, but in obstetrics, if that's what you're getting at, it does increase the risk of certain complications of pregnancy, large for gestational age, baby that's excessively large that can lead to either the baby getting stuck in the birth canal and being injured or injuring the mother on the way out, higher risk of gestational diabetes. Those are all things that are of major concern.
Okay, good.
Yes. Now, what about vitamins and calcium? How do they help?
Vitamins in general are most likely helpful, especially if somebody has a diet that may be deficient in certain areas. Calcium becomes increasingly important for women in the menopausal years, and the National Osteoporosis Foundation recommends that women get 1,200 milligrams of calcium as a supplement, as well as 800 to 1,000 international units of vitamin D.
Okay. Now, another question that we often ask our panelists is to share their respective success stories with our viewers. And I'm sure you've had many in your field. Can you share at least one with our viewers?
I'd be happy to. My favorite one came on actually almost my first day here. I saw a very nice young woman in the clinic who had severe left-sided pain from a large ovarian cyst, about that big. And we were able to get her booked for a laparoscopic procedure, and we did a laparoscopic oophorectomy. She went home the same day. She did wonderfully. And I was just really impressed with the OR team and all the people I worked with, who were all new to me at that point. I thought people handled the situation beautifully, and I was just really pleased to be a part of it.
What's the CAPC program?
CAPC program stands for Community Action for Prenatal Care. And it's a program designed to help women really at the fringes of the healthcare system. So women who either are at high risk for contracting HIV or women who may not seek prenatal care. These are women often who are victims of physical abuse or have substance abuse issues, or maybe have immigrated here and won't go for care because they don't have insurance and they're concerned about the financial issues or things like that. So this program has counselors that reach out to those women, try to bring them into the healthcare system and make sure that they get the care that they need.
Okay, so you're enthusiastic about this program also?
Absolutely. It's a program that we participate in. I think it's a great program.
Now, you mentioned earlier mammographies as an important screening test. Why has there been so much controversy around it? And is there a specific age that you recommend that women come forward and take this test, or should they delay it to a certain age?
It's definitely something each woman should discuss with her provider. The controversy really, I think that you're referring to, centered from the United States Preventative Task Force Services report recommending that women delay mammography till age 50. There were subsequent studies that came out showing some benefits to starting at age 40. I tend to be very conservative with breast cancer screening. I still recommend starting at 40. I've seen a lot of early breast cancer in my career, and I'm very reluctant to have people delay that.
Now, there are two other programs that you're actively involved in. The centering program, what is that?
The Century program is a group care program, and we're using it right now for our pregnant teenage patients, and it's a great program. You put them together in a group, and they get health assessment, they get education, and they get support all within that group. And it's actually been very successful, it's been very popular, and there are studies in the literature showing that it actually is very effective and can reduce things like preterm deliveries and increase things like adherence to breastfeeding.
Okay, let me ask you a question. How does someone get to your division? They want to come into they just came in the community, and they want women's health. Where do they come, and how do they get it?
Well, we're located on the 14th floor of the hospital, and as I said, in the main building on the Grand Concourse. So if somebody is in need of a walk-in appointment, they just show up. I don't know the phone number off the top of my head, but we can get that.
99 Bronx.
Okay, and if somebody wants to make an appointment, they can call that number and just ask for the Women's Health Center.
Right, yeah, okay.
Right. Now, what else do you see on the horizon in women's health? What kind of things will be coming for women in the future?
Well, I think we're going to see a continued shift of minor surgical procedures moving out of the OR and into the office setting. I think that it's a step in the right direction. I think anytime you can keep people in an office setting instead of a hospital, you minimize their risk. Things like MRSA, all the sorts of things you can pick up in a hospital, hopefully we can avoid in an office setting. I also think we're going to continue to see more and more laparoscopic procedures and fewer open procedures. We're seeing people do things now laparoscopically, like hysterectomies, that 20 years ago people would have told you couldn't be done that way. So I think there will just be an increasing shift towards outpatient procedures and minimally invasive surgery.
I think like the original operations that were done in the kitchens, we'll probably go and do some operations in the patient's house eventually.
That would be the ultimate inconvenience, I guess, right?
But on that note, let me thank you, Dr. Heck, for joining with Dr. Gums and myself on tonight's HealthBeat television program. And most importantly, let me thank you, our viewers, for tuning in and joining with us this evening.
In the interim, if you have a medical question or need assistance, I encourage you to call our physician referral service by dialing 718-99 That is 718-992-7669. Or you can refer to our website at bronxcare.org. Good night, and we'll see you next week.
In looking to the children, our future, we take pride in the new to the children, our future, we take pride in the new pediatric pavilion that is nearing completion. It will include